And a negative COVID-19 test doesn't mean you're in the clear. This morning, the FDA is warning a test made by curative labs can return false negatives if it's not administered correctly. It uses a saliva swab, which is analyzed for the virus's genetic material. The FDA suggests retesting anyone who may have gotten an inaccurate result from the test in the last 2 weeks. And we are speaking right now with Dr. Hugh Cassiere. Dr. Cassiere is the chief of the Division of Critical Care Medicine at Northwell Health. And Dr. Cassiere, let's talk about this. How common is it that we get false or inaccurate test results?
Two main types of tests. There's a PCR test, which measures the virus's DNA, and then there's a protein-based test, and those are the rapid tests, and that's the one that the FDA put an alert out. You can have active virus and have a negative protein test. That's well known, and it's very concerning. And most institutions that require a COVID test, the request is to do the PCR test. Now that takes longer. It takes 4 to 8 hours to do. Those rapid tests take 15 minutes, but it checks for the protein. So you may have the virus, but not enough protein to trigger the test being positive. So it really depends on what test you're getting.
So before we bring up our next viewer question, do you suspect that a lot of the COVID-19 surge we've been seeing, which is believed to be from holiday travel, do you believe a lot of those people were maybe going on that one rapid negative test and then just hopping on a plane, and that may have contributed here to the spike that we're seeing?
Yeah, definitely possible. And again, I've said this in the past, getting infected is a probability, even with the mask on. So if you're around the person at the wrong time who coughed, even with the mask, there's a low likelihood you can get infected. So just imagine people congregating, even with appropriate social distancing and a mask. Indoors is really is a really bad place to be with someone who's positive.
And it's almost scary to hear about this new strain then and how it's up to 70% more contagious, because you kind of wonder how much more contagious can it possibly be?
Yeah, I mean, you've been out shopping and go around and do your local errands, and people wear masks. They put them below their nose. They take them off for a little while. They touch them, then they touch their eyes. Just imagine a virus being a little more, have more infectivity, and you can imagine the numbers are going to increase if the strain permeates.